Hi, I'm Dr. Ramsey. Welcome back. Today, I want to share something with you that really caught my attention. It's a condition that has increased in significance over the last 40 years that is extremely preventable. I brought an expert on to talk to you about this and educate you. Her name is Corrin, and we're going to talk about the prevention of esophageal cancer. So, Corrin, give us some statistics that shocked me.
Yes. So esophagus cancer or esophageal adenocarcinoma has actually risen 500% over the last 4 decades.
Mm.
And unfortunately, when diagnosed with esophageal cancer, it has an 80% mortality, meaning only about 1 in 5 patients will survive this deadly disease.
And what we're going to talk about is how to diagnose it before it gets to be esophageal cancer. And we can prevent that. We have done that. We've reversed this in patients in the past. And so esophageal cancer is this tube from our mouth to our stomach. One of the big things I learned is that people who take chronic antacids are the biggest risk of esophageal cancer. Am I right?
Yeah, so when you're taking chronic antacids like Prilosec or Nexium, those medications are great because they help those symptoms relax and go away, and we can eat the foods that we like. But unfortunately, over time, the acid is still building up in the lower esophagus, kind of like a pain medication where it's masking the symptoms.
Mhm.
Does not mean that the acid is stopping, is not still coming up into the esophagus.
Mhm.
So that's exactly correct.
Right. And then there's other high-risk populations. So people on acid blockers.
So the highest risk for developing precancer and cancer in the esophagus are those who do have chronic reflux symptoms. Also, men, people who are Caucasian,
Mhm.
over the age of 50 years old, central obesity, history of or current smokers, and then the big one is family history of precancer or Barrett's esophagus or esophageal cancer.
So yes, Barrett's esophagus is a name for precancer cells. And so we can identify these cells, is what we're going to talk about today. And therefore you can become proactive, not reactive, proactive to reverse those precancerous cells. So the test is called EsoGuard.
Yes. So first off, Barrett's esophagus, just to kind of go into EsoGuard. So Barrett's esophagus is the precancer, like Dr. Ramsey was saying, to esophageal cancer or esophageal adenocarcinoma. Our test, EsoGuard, is able to detect those precancer or cancerous stages in the esophagus through a simple cell collection.
Mhm.
So very quick and easy cell collection that's done less than 3 minutes or less on average to complete the test in an in-office, non-invasive setting.
Yeah, very nice. And I know that you can come here, but you have some offices we'll talk about at the end where patients can go who think they might be at risk. And I think it's a great idea for all of us over 50, not just men, to just get an idea if there's something we can prevent because you shared with me. Do you mind sharing with them about your family history
Oh,
too?
yes, yes. So I actually have the reason I got into this industry is because I do have a substantial family history of the Barrett's esophagus. My mother and grandma actually have the precancer cells, and fortunately, they had was some very bizarre symptoms like a dry cough, and I reached out to them and asked them about or told them about EsoGuard, and they ended up being actual positive for Barrett's esophagus. So I think being able to detect this disease very on is crucial for patient outcome.
Yeah, I was amazed by the dramatic increase in prevalence. Let me see, what else do I want to ask you? So, Corinne, tell us exactly how the test is collected.
Yes. So, like we previously stated, this is a quick test, about 3 minutes on average or less to complete the cell collection. How it works is the patient will swallow a capsule about the size of a multivitamin. There is a tiny little catheter attached to it. And what you do is you drink some water and just swallow the capsule like you're taking a normal vitamin or pill at home. We're able to advance that down to the lower esophagus. It is painless, completely painless. And then we're able to get a gentle cell collection, bring that up, and send that to our lab for testing.
So it's about a 5-minute test.
On average, yep,
Mhm.
very quick.
Okay. I mean, non-invasive, well, it's invasive, but it's simple
Yes.
to give us the data that we need to prevent this. And I know how easy it is to prevent this and reverse esophageal cancer.
Yes.
So win-win.
Yeah,
Mhm.
100%. Yes, definitely.
So for those of you who are interested in doing the test, Corinne can come here and do the test on you, or you can go to one of their 3 locations, which, Corinne, where are they?
Yeah, so we have 3 office locations all spread throughout the valley. We are located in Peoria, Tempe, and then we do have a Scottsdale office as well. So whatever works best for you.
Well, thank you so much. I think it's really helpful to educate people on something simple that they can do to prevent. That's what we're all about in education. So take advantage of this. If you're interested, give us a call if you have any questions. Have a great day.